I just wanted to share a very quick point about technology. I had my teeth scanned, it's not the first time, but I had my teeth scanned yesterday, which is probably what precipitated the thoughts on this subject. Because at the time I thought to myself, rightly or wrongly, and I'm not making a judgment call here, but I thought, if you are well trained to do this, i.e. you know what you're doing and you've done it a number of times before successfully, taking impressions is a very large part of dental practice. Scanning can be a fantastic adjunct to a dental practice, but I can't help but feel that sometimes it's really a very complicated way of going about doing it. However, there are lots of other advantages, like the fact that the scan could be sent, the bite registration could be sent without using the mail, and that's got to be a benefit, or courier, same thing. So that in itself is not what I was going to talk about, but I think that came to mind, or brought to mind, I suppose, really, the subject that I wanted to talk about, which was technology. And this is going to be very short, but and it relates to taking medical histories. I was thinking the other day that when I think back of all the times I've taken medical histories and dental histories, it's very difficult to get my patients to actually tell the truth. When you ask, what do you have problems? They say, yes, I'm anxious, yes, I'm nervous, yes, I'm scared to go to the dentist. But they never actually say why, and so the mere fact that we know there is anxiety or fear doesn't really help us overcome it, because we don't actually know what it is that makes them fearful. And what they say, fear is in itself not it's nothing actually. But when it's combined with something, that's when it becomes fear, rather than just a word. So what I was going to say was, in the good old days, we took the history ourselves. And I think, for the sake of 5 to 10 minutes, I think there are great benefits in not using a tablet, in not even using, dare I say this, an assistant, but actually take the history ourselves, and to go one step further. And when somebody says something like, I'm fearful, I'm anxious, I've had a bad experience, to say, oh, tell me about that. Now, yes, I know that sometimes that opens the door to their life story, and we've got lots of other things that we're supposed to be doing at that point anyway. But I think the value shines through. The other thing we can do, and this is, in my eyes, a better way of doing it, and truthfully, this is not something that I did, but it's something that I now do, and I wish I'd thought of it before, and that is do a combination. So you're sitting there with your assistant, she's writing, you're talking to the patient. At any point in time, you can then pass that on to the assistant, and she can finish up, or she can start, or she or he can complete the histories. But to be there for part of it, and it's got to be done politically correctly, but to be there part of it, I think scores big in a patient's eyes, because you're not just the name, you're not just someone who, and it's even worse now because we wear masks, right? But it also makes life easier for us, and also I'll just finish by saying that as much as it's nice to do it that way, it does depend on the questions we ask. Many of us use, I'm actually going to just say many of us, but I didn't. Many of us use a stock questionnaire. I think it's really prudent to sit down one day with a cup of tea or a cup of coffee and to actually either customize it or rewrite it according to us. There are some things that are common to everything. Medical history is one of them, but it doesn't matter if we customize that to get a little bit more information out. When it comes to dental history, which is, after all, what we're going to be basing our proposals on, we need to know what's going on. It's very beneficial for us because we know how to circumnavigate their concerns about having the treatment, the care that they need. So the two things that I would say is revisit your history content, the questionnaire's content, and the second thing is, this is a suggestion, is to consider making it more of a human contact rather than just something that the patient does in the waiting room to get in, and they're doing it purely on a tablet on a tick basis. And of course we all know that sometimes that always doesn't get read either in the same to the same level of depth or indeed at all at times. So anyway, it wasn't meant to be judgmental. We all get busy, but the idea is to set things up to make life easy for us, not difficult. Anyway, thank you, and we'll pick it up next time.